Reporter Abra Barbier is there. Let's cross now live to her. A very good morning to you, Abra. Day 2 of the lockdown. What is Cape Town looking like?
Desiree, a very good morning to you too. Yes, those figures that you just quoted now, that the Western Cape is the second highest in the country, they are really scary. And we are back in Mitchell's Plain today. Myself and my camera operator, Hubert Slingers, we decided to come back to Mitchell's Plain today because Mitchell's Plain, of course, yesterday became such a talking point when we drove through here and we realized just how people on the ground, I don't want to say they are flouting regulations, because the bulk of the people we spoke to were out and about getting essentials, getting food, getting medicine, getting their prescriptions filled. Many people only got paid yesterday and today. So this is why we are seeing queues like this. Other malls we drove to, queues are snaking right around the malls. So yes, people need to get food on the table. We do understand that. But I don't think people are truly aware of the health impact. Yes, there is a socio-economic impact, there's a massive economic impact, but I don't think people are fully aware of the health impact, because right now we at least can still stand in these queues to come to the shops. But what happens if this goes to the next level? And that, of course, will only happen if people don't comply and if the numbers continue to increase, which they are going to. So what we do know from the Western Cape today is that yesterday around 65 people have been arrested provincially for non-compliance with the regulations. The joint committee is meeting today. That's the SANDF, the SABC, Metro Police will all be meeting. They're actually sitting in a meeting right now. I'm hoping to get an update from them later on this afternoon, where they will be discussing further plans that will be taken, or further regulations, or further what they're going to do to make sure that there is more adherence, to make sure that they can clamp down on people just roaming around unnecessarily. Yesterday I was driving through certain areas. People were drinking. People obviously don't understand what the impact of alcohol and the impact of smoking does to the immune system in times like this. I spoke with ACDP MP Steve Swart earlier on. He, of course, has been tested positive. I put in a call to him. He's somebody I engage with regularly because I am based in Parliament. And I just put in a personal call to him to ask him how he's doing, how he's coping, how he's holding up. He says that he and his family have been through the worst. They are coming to the tail end of this. They've just been bulking up with as much vitamin C and supplements and drinking as much water as what they can. He says prior to him becoming infected, he was doing everything correctly. He was doing all the right stuff. He was sanitizing. He was maintaining social distancing. And still, he fell ill. And he says the worst part was the exhaustion. He's just been so tired. And he says, obviously, this is because your body is fighting an infection. And he said that's been the worst, is that he's just been needing to sleep. And, of course, that's what your body needs to recuperate. So he says even though he was doing all the correct things, he still got infected. I don't think we realize just how easy it is to get the coronavirus. People do not understand this, and I think that message needs to be driven, is that you might think that you are safe, but you need to comply. You need to be washing your hands. You need to not be touching your face. You need to be maintaining your social distancing. You need to be at home. You need to be in lockdown. I mean, I think shops should actually have a kind of a system where they say during certain times, they will allow certain people in, or there should be some kind of a system where this can be avoided, because the social distancing obviously is not being enacted over here. People are still standing quite close to each other. Not everybody has masks on. Very few people have gloves on. And it's really sad, because they are here because they have to be here. They are not here because they want to break the law. They have to eat. Their kids have to eat. That's the reason these people are here. But we just need to continue driving the message home that this virus, we can't play around with it. We need to get the numbers down, and we need to get it down fast. Italy went through the same thing a few weeks ago. People in Italy did not take this as seriously as what they should have, and look where they are today. So we are waiting to hear from from the presidency, from the National Health Ministry later on about what the latest updates, what the latest figures are. And of course, I will be reporting to you about what the latest is from the Western Cape when I get that information from the authorities in the Western Cape. Desiree?
Thank you, Abra. We'll await that. But of course, we don't lose our sense of culture and fashion in these grim times. I'm curious about your mask. Tell us about it.
I've got a big smile under the mask. I'm very excited about this mask. Actually, I got it from one of the managers in our region in the Western Cape, and I am very happy I'm very happy about this mask. Actually, when I met a lady in Mitchell's Plain yesterday, I was so upset because my mother-in-law, she's a seamstress, and she's so innovative herself, and I thought before the lockdown I should have actually gone to her, and she would have been able to churn out a couple of these in no time, but obviously I left it too late because I can't get to her. But yes, I'm quite pleased with the mask that I'm wearing, and I'm very grateful to my colleague Linda Smith, who made sure that myself and Hubert, my camera colleague, are all sanitized and clean and safe today. So thanks, Linda.
Abra, thank you so much for that update. Of course, the mask production industry booming at this time. That was our reporter, Abra Barbier. The South African Medical Association, SAMA, says it has been approached by concerned GPs who are unsure of how to protect themselves and their patients. South African Medical Association spokesperson Dr. Angelique Kotze joins us now on the line. Dr. Kotze, very good morning. Thank you so much for your time. As the association that represents doctors, what trends is the association picking up?
Well, there's two trends that you need to understand. The one is that all our members are just as concerned and worried about their own safety than the public out there. There's no difference between the real fear of the doctors and the patients. The second thing is there's a lack of masks.
Are you still with us,
Hello?
Dr. Kotze? We can hear you.
Yes, I'm still there with someone else on the line. So what is important is to understand that there is enough protective gear out there. The National Department of Health is acutely aware of this. There is not enough more. Protective gloves is not enough gloves out there. This morning I spoke with one of the National Department of Health spokespersons, and they're now busy in the background with the National Defence Force to send a cargo to China to go and fetch some of these equipment or protective gear that is extremely important for doctors and nurses to wear, and hopefully that will also help alleviate the problem. The other problem that SAMA had picked up from their members, not only from the private sector, because there is really a lack of protective care in the private sector, also in the public sector, and there the problem is, I think there's a lack of stock control, and that some of the hospitals are saying, the managers are saying they have stock when they are asked by the National Department or by MECs. But then the reality is they don't have it. And it's not a crime if you don't have enough stock or protective gear. Just be open about it so that we can know how and who to help with this. Otherwise, it becomes a huge problem, and everyone's lives is put into danger. But again, on the GP side, what we are advising our GPs is to use their clinical skills. If a patient, first of all, only the patient must come into the consulting rooms, and surgeries themselves, the rest of the family must stay outside or in the car. Then once if they are inside the building, the chairs must be at least 1 to 2 meters apart, so there should be a limited amount of patients in the waiting room. Once if they get into your consulting room as a doctor, especially if they have any respiratory tract infection, you need to see them within between 5 to 10 minutes at the longest, because you need to get them in and out as that lessens the infection rate or your exposure to the virus if there has a virus underlying. Also, if you see the patient coming into your consulting room and you use your clinical skills and you see this is really a sick patient, it's not difficult to see a patient who's suffering from pneumonia. They don't look like someone going to the shopping centers. They're really, really very, very sick. You do not touch them. You do nothing. You pick up the phone. You call the lab and ask to do a throat swab. You also then immediately contact your nearest hospital, speak with the physician on call, alerting them that this is a possible case of corona coming in, and that patient also needs to have an X-ray. So you will need to speak with your X-ray department to say, please, we need an X-ray of the lungs. These people are really sick. They have pneumonia. Those are the patients you do not touch. You don't even let them come close to 3 feet from you, 3 meters from you. That is the one very, very important thing. The other thing is, again, if you don't have protective gear, please remember what I've said. It's literally less than 10 minutes that patient must sit in front of you.
Yeah.
You examine, you're out. The patient is out. You wash your hands immediately with soap and water. If that patient unfortunately coughed, you wash your face as well with soap and water. And that's the best we can do with the lack of protective gear currently available.
Have there been instances where doctors have presented and suspected that they got it from their patients?
Well, there's 4 cases in Gauteng of doctors that's been that have contacted the virus. It's not sure whether it came from patients or whether they have been travelled and got it in that way.
And what's the latest on those cases? Are you able to tell us?
All four of them fall in the 80% mild category. So they're not none of them are hospitalized as far as we know.
So if I hear you clearly, Dr. Kutsia, you're saying that if doctors use their training, they bring it to bear, they can be able to deal with any such eventualities.
Well, if you use your clinical training, you need to distinguish between the 80 and the 20%. Remember what you said, 80% of patients will have mild symptoms. 20% will really be sick. A sick patient is a sick patient. Then, it's a patient with temperature. It's a patient who really struggles to breathe. You will see that patient is sick. That patient you do not touch. Okay?
Yeah.
The patient who's the 80%, you need to take now I'm talking if you don't have any protective gear, you don't have a mask as a doctor, you don't have gloves.
All right.
So you try to get that patient within 5 minutes, between 5 and 10 minutes, out of your consulting room.
Yeah. So those people who fall within the 20% bracket, could they be those ones, could the asymptomatic ones fall within the 20% bracket?
No. The 20%, that 20% will be symptomatic. They're really sick. They're really, really sick. And this progress very fast. So it means I will have my about 5 days of quarantine, subclinical infection before I get, before I feel the symptoms. So let's say the average person will feel it on day 5. So I will feel a bit feverish today, a bit fluish today, and tomorrow maybe, and maybe the day afterwards. But from there on, it takes about 72. It takes about 3 to 4 days. You will be in ICU.
Yeah.
That's how fast it moves on the 20%. It's really sick people.
Oh, the 20% is the really sick ones. What the question I was trying to ask is how the doctors deal with the ones who are not presenting with the symptoms yet.
Oh, sorry. There's nothing you can do. You just try you need to expect that each and every one coming into your rooms, regardless whether they come for a urine tract infection or bladder infection, you need to assume everyone is COVID positive. Therefore, you need to do the same, take the same precautionary measurements to make sure that you are safe as much as you can, you and the other patients sitting there, and as well as your staff.
Yeah. because it's a real issue, isn't it? How is the Medical Association dealing with the conversation around Italy, where it said that medical doctors, retired medical doctors, have had to be called in because most doctors have fallen ill to this pandemic?
Well, you know, there's nothing we can do about what happens in Italy. I suspect the same is going to happen here, because we are going to have a lack of personnel if, with the current trend with lack of protective gear, it's definitely going to happen under the medical and nursing staff. So the question is just who's going to treat the patients then in the end. So you will have to bring in the elderly retired doctors, and remember they are the problem with them. They are the falling into the category of high risk. So it really becomes a problem, and it's not unique to South Africa. This is what's happening in the rest of the world. This is what we're hearing, and therefore our members are extremely concerned. And not only SAMA members, I think the average doctor out there are really concerned. So some of the doctors decide that they're not going to see patients. I cannot force them to see a patient if I can't give them protection or guarantee them that at least I have a mask and a glove for you.
Dr. Coetzee, you were talking about the shortage of masks and gloves and protective gear, but there's a whole lot of a list of products that have whose demand has shot through the roof. Your ventilators, test kits,
Yes.
beds. How are we going to circumvent this shortage?
No, that's why we have self-lockdown. That's why we have got an emergency lockdown. We're trying to flatten the curve. We have said this how many times? Stay at home when you're sick. No, but people don't listen. You know, just look at what happened now this last 2 days when people wanted to go and buy groceries. Everyone, I'm quite sure, has heard before social distancing. We have said it how many times? At least 1 meter from each other. Do you think each of those people standing in the queue waiting to pay was 1 meter away from each other? No, they were not. They didn't listen.
Well,
so how are we going to make sure that these people are staying safe? Just listen to what we are advising them, please.
Dr. Angeline Coetzee is from the South African Medical Association, and she was telling us there about measures that are being taken to protect healthcare workers, especially doctors. Let's take a break.